All right. Today we're going to be talking about a topic that a lot of people have questions about, and yeah, a question that a lot of patients will ask me about, and it's something that they should be considering. So today's topic is orthotics. So a lot of times when people are experiencing plantar fasciitis, Achilles tendonitis, low back pain, hip pain, sometimes their physicians or physical therapists, chiropractors, and other medical professionals will encourage a patient to get orthotics. And so I want to talk about this topic today and kind of talk about some myths that are out there regarding and circulating around orthotics, and give you guys an insight on what they're actually doing, when they should be considered and when they shouldn't be. And I want to also talk about what they're actually doing with regards to the skeletal alignment and what they may be correcting or not correcting. So, big thing is orthotics can be useful in the short term. A lot of times people can get significant pain relief right away just by using orthotics. But a lot of times in the long term, it doesn't provide that long term relief. And a lot of times orthotics encourage reliance. Essentially, orthotics are just a version of a brace. And I've talked about in other uh, previous talks about braces and how, just like orthotics, they can cause reliance and really not treating the root issue of what's going on. So what are they actually doing? So what orthotics are doing is they are just providing support for the foot and helping with the alignment of the body. However, once you start walking around or not using orthotics, your body's just going to go back to its default positioning. Okay. So to get that alignment, if they're not working on treating the underlying issue of why they have flat feet in the first place, the body's just going to go back to its normal state. Okay. If you don't have that orthotics, this leads to reliance. Okay. Bottom line, they're not fixing an underlying injury or solving the root issue. So when should they be considered and when shouldn't they be considered? So they should be considered if a patient, for example, if a patient comes in and they're having Achilles tendonitis, foot pain, and we're thinking that it's due to the patient having a flat foot. And first thing that I do is I check, is it because they have a skeletal abnormality? Is the way their foot structured just the way it is and incorrectable? Or do they have a decreased arch because their muscles in their feet are weak? Or is it the hip is weak? Because that can translate down into the foot as well and cause that arch to collapse. So that's the number one thing that we need to figure out. Is it a skeletal abnormality? Because skeletal abnormalities are usually harder to fix, right? No matter how much we strengthen something up, it's not going to change the skeletal alignment if that's just the way the foot is shaped. However, if we determine that a patient is having flat feet because of weakness in their foot, but their skeletal alignment is good, that means we just need to strengthen that foot up. So a way you can tell this is, what I do is I have a patient, and you guys can do this too, and test it on yourself too, or have somebody look at it. Obviously, I encourage you to have a medical professional look at this, but most of the time it's pretty pronounced, and you can tell yourself or have a spouse or a friend take a look at it as well. So what I have a patient do is I have them lay flat on their back, and I look at their feet. I notice that what I'm looking for is the foot flat, or is there an arch? Okay, and most of the time, people with flat feet, okay, actually have good arches when they are not in weight bearing or if they are like laying down. Okay, most of the time they have good arches. The problem is, once I have them stand up, guess what happens? The feet collapse in, the arches decrease. This tells me that most likely the issue is that they have weakness. Okay, because when I lay them down unweighted, okay, where the foot doesn't have to work and it's just in a neutral position, they have good skeletal alignment of that foot. All right, and that's the majority of the cases. But however, if I have somebody lay on their back unweighted and supported, and they still have a flat foot, that tells me that that's just the way their skeletal alignment is. And in those cases, I would encourage somebody to use orthotics, okay, for the time being, but encourage them to still try and work on strengthening, okay, both at the hip and the foot, depending on what part is weak. And sometimes even people with skeletal abnormalities can get relief and not be reliant on orthotics. Patients that have good skeletal alignment, and I just noticed that once I have them stand in a weighted position and I see that their arches are now collapsing in, that's just a weakness issue. That's something that can be totally corrected. You just need to strengthen up the weak areas, whether that's the foot or the hip, okay? And do a biomechanical assessment on what is the problematic area there too, okay? So even with somebody that's been, so for example, if somebody comes in and they have weak feet and they're using orthotics, do I just tell them to throw out the orthotics and be done with it? No, because what happens is they've been relying on that orthotic. If I have them just throw that out and start trying to use their feet as they should, it'll be too much stress on that foot and it's going to lead to issues. So you can't just quit. You can't just get off orthotics cold turkey. You have to be strengthening up the foot in the meantime and then gradually weaning off of those orthotics as well, okay? So then again, you got to figure out, is it actually the foot at all that's a problem, or is it the hip? Because if the hip's weak, that knee is going to collapse in, and when that knee collapses in, that foot also collapses in as well. And a lot of times when people are having ankle or foot pain, they think it's the ankle or the foot, and sometimes it's not the case. Sometimes it's just the hip or just the foot, or it's a combination of the both, usually of the two, sorry. And that's usually the case where it's a combination of both hip weakness as well as foot weakness, okay? So what are some things that you can do to correct this? So like we talked about, strengthen the foot, right? That underlying issue. So you know, you're, instead of just like throwing random exercise at it, or like, I think it might be coming from my foot, I'm gonna do foot strengthening exercises. Make sure you assess, don't guess on where the actual issue is. And then also correct imbalances, not just with regards to weakness. It can be also mobility deficit. For example, if we have mobility restrictions at the ankle or the hip, it can change the way that we walk and the way that we run. So you also have to make sure that you're identifying what part or what area has immobility issues, because that can impact your gait mechanics and your running mechanics. So you want to also correct those walking and running mechanics. So another thing is correct your training. Sometimes people with regards to how they're moving and how they're training are reinforcing bad habits, okay? And so you want to figure out, make sure that you're moving correctly with the exercise that you're doing in your strength training program and your workouts overall, okay? So big takeaway here, guys, is know that you can use orthotics to begin with if you're having extreme pain and you can't even like walk without pain, and if you throw an orthotic in there and you get relief, use that orthotic for the time being. But while you're using that orthotic, you should be trying to wean yourself off through corrective exercises such as mobility and also strengthening exercises, okay? You don't want to just throw the orthotic in and be like, oh great, I'm getting relief, and then just don't do anything else. Like, that's the wrong way to go about it. And actually that's the route that I see a lot of people go, and over time it leads to other issues up the chain, such as in the knee and the hip, because that root issue isn't being corrected, okay? And once you can only spend so much time in orthotic. Like, most people walk around their house without shoes. Like, that can lead to other issues as well if you're super reliant on the orthotic, okay? And leads to issues up the chain, okay? So another thing too is, you can try and go at this at your own, but there's so many moving parts with regards to, is it coming from the foot? Is it coming from the hip? Is it a weakness issue? Okay, and if it is a weakness issue, is it the foot or the hip? Next thing is, is it caused by mobility restrictions of the ankle, knee, or hip? Or is it because your running mechanics or your gait mechanics are off? Or is it because of the way you're training, right? So by having a specialist look at those things and get you on that straight and narrow path, you overcome this injury much more quickly and get back to your normal active self too. So I encourage you to find somebody that has a track record for correcting this. We actually have a foot and ankle specialist on staff, and he sees plantar fasciitis, Achilles tendonitis, and foot and ankle issues day in and day out. And he deals with people that have been relying on orthotics for years and get to the point where they correct the actual issue and get it so you don't even need orthotics in the first place. Okay. So I encourage you to find a specialist. We've got a foot and ankle specialist on staff. So if you guys want to speak with him and see if it's a good fit and that we can help you before scheduling an evaluation, we're happy to do so. And if you have any questions in general whatsoever, please let us know. Hope you guys found this beneficial, and we'll be talking to you soon. All right. Thanks, guys.